Are you experiencing horrible gut symptoms like bloating, constipation, diarrhea, and gut pain, but you're not sure what's going on in your body? Then you're going to want to watch this video. I recovered from Crohn's disease and I've helped many other people get better from all sorts of gut issues, even when they were undiagnosed. But in this video, we're going to go over every single gut disease, their symptoms, how they get diagnosed, what does your poop mean, but I'm really going to get into the details and show you exactly what is going on in your body. I promise you, you've never heard half the things that I'm about to tell you, and they changed my life. Now, the way I help people get better is with my 13-day protocol. In my bio link, I have a free mini version of this. So if somebody has stomach ulcers, they're going to feel a burning pain here. And that burning pain will switch from a burning pain to a pressure pain. And that switch is dependent on a type of stress in your life. For men, it's going to be a territorial anger, and for women, it will be a territorial anger or an identity conflict. I don't know what territory I belong to. Now, I've seen one guy experience it when he had a landlord that was just being completely obnoxious. He had burning pain, burning pain, burning pain. So it's now stomach ulcers surprisingly only appear at the top of the stomach in this red section right here, but mainly right here. The vast majority of them are in the beginning of the duodenum right here. So during the conflict active phase, I can't stand my landlord. He's such a jerk. Cell loss, cell loss, cell loss. And it burns. It's a burning pain. And when acid gets into those ulcers, it burns and it really irritates. That's why taking some sort of an alkaline substance like baking soda, not baking powder, baking soda, sipping on baking soda water after a meal, it helps neutralize that acid so it's not burning. I did not make these discoveries. This was discovered by a brilliant German doctor. His discoveries are called GNM, or some people will call it Germanic healing knowledge. Essentially what he discovered is he could look at your brain CT scan and know exactly what health conditions you had. Now everybody with heartburn or H. pylori, they'll have a ring in their brain right about here. It's not in the brainstem, it's in this part of the brain right here. But he found that every single disease is controlled from a certain part of the brain, and it happens after a conflict shock. Now, when the territorial anger gets resolved, the cell loss stops and it starts cell restoration, and it will be a pressure pain. And H. pylori, the bacteria, actually helps with that. And there are tons of lab studies online that show that stress, just stress alone, will change the gut microbiome. In my free webinar, I share much, much more of the science behind this. And when this process is going on, a lot of the times the sphincter up here does not close correctly and we get GERD and acid reflux. And the way this gets diagnosed is they do an endoscopy and they look down there with a camera and see if they can see anything, and they will also usually do a biopsy so they can look at that tissue under the microscope, because a lot of the times you'll look at it with a camera and it will look fine, but then when you look at it under the microscope, you'll see microscopic ulcers. There's also another term called gastritis, and that's just essentially somebody who has stomach ulcers, they're conflict active most of the time, they're having a lot of burning. Somebody who has gastritis, they're switching back and forth between conflict to active and resolving that conflict. The inflammation starts to repair those cell ulcers when the conflict gets resolved. And now a lot of people treat inflammation like it's the worst thing on earth, like, oh, I gotta eat anti-inflammatory food. Like, that phrase is so dumb. Like, it literally makes no sense, because inflammation is the body's response to injury. The doctor that recommended putting an ice pack to stop inflammation, he actually wished he never wrote that book, because inflammation is the body's healing response. There are times we do want to use ice and reduce inflammation. We don't want to suppress inflammation. We want to avoid the injury which causes inflammation. Inflammation is healing. So now we get into the small intestine. The very first part of the small intestine is called the duodenum. Some people call it the duodenum. And here it gets connected with the pancreas, which secretes enzymes to help break down this food. It's also connected to the gallbladder, which secretes bile that helps break down fats. So there's also something called gastroparesis, and this is where the stomach muscles stop pushing food out of the stomach. And this is simply caused by a conflict of I need more time to digest this hard to digest important thing for my survival. Essentially what your brain is doing is it's trying to spend more time digesting this thing. If it's holding it in the stomach, why else would it do that? Why are all the other muscles in your body working just fine? Your brain controls this. So, and then you have the duodenum, and then you have the ileum, the last part of the small intestine. There's a condition called BAM, bile acid malabsorption, or somebody just gets diagnosed with gallbladder issues. And we know this is happening when someone has a green stool. It can also be yellow, but it usually comes out, it burns, and it stinks. Like you want to cry when you smell it. It smells so bad. And your farts will stink too. So this shares the same relay as heartburn. And so when we experience a PTSD trigger or the conflict becomes active, the gallbladder goes into overdrive and it squeezes all the bile into your intestines. So imagine that bile gets squirted into your intestines. What's it going to want to? It's burning. We need to get it out as fast as possible. So it triggers diarrhea. And when that happens, all of the muscles contract to make the distance shorter to your anus, and then it starts forcing it out as quick as possible because it's really irritating to be sitting on your intestinal mucosa. It's usually diluted with food and has a controlled release. It just got dumped. And the way that we fix this is for a lot of us, we need to track down our PTSD triggers, which I go into way more detail on in my free webinar. But like I would get diarrhea from smelling vegetables and I wouldn't even get angry. I'd be like, yuck, vegetables, whatever. I'm going to keep eating my hamburger. But it stemmed from childhood trauma of being stuck at the dinner table, being forced to have steamed green beans. I want to puke just thinking about it. They were so gross. I hated them. Just becoming conscious of that subconscious reminder stopped sending me to the bathroom every single time I smelled green beans. So the next term is SIBO, small intestinal bacteria overgrowth. There's also this new term coming around, small intestinal fungal overgrowth. And the way that they diagnose this is with a breath test. These bacteria produce a certain gas and they read it on this test. So everybody with SIBO is going to have a ring in their brain either here or here, these top two pink relays up there. This is the brain stem that we're looking at. And now the type of growths that can happen in the small intestine are only flat growths. These growths help with absorption. So the conflict is, what was something important to my survival I couldn't absorb? And some people will say that they're usually frustrated or angry or annoyed. They can't digest this thing. I usually see it be either money, because money can buy everything, or a boyfriend or a girlfriend. Now, a lot of the times they do this breath test and the numbers are high and the person doesn't have symptoms, because what's happening in the conflict active phase as these cells are developing, bacteria and fungi, or mycobacteria to be more specific, are growing behind the scenes, but they're not active. When the conflict gets resolved, the bacteria and fungi start to break down this extra tissue and become active, and that's when it causes symptoms. And now if the conflict stays resolved and the person doesn't develop PTSD triggers, and this stuff happens in the subconscious, so it's really hard to predict how someone's symptoms are going to be. But somebody who has bad symptoms, chances are is the conflict's off and on all the time, and they have a lot of PTSD triggers they need to deal with. And just becoming consciously aware of these PTSD triggers a lot of the time fixes the issue. So this bacteria and fungal growth is controlled from your brain. We evolved with bacteria and fungi. We are more bacteria and fungi cells than we are human cells. They are a part of us and they are controlled from our brain. I've seen too many people take tons of probiotics and have nothing to show for it, take tons of antimicrobials and have literally zero to show for it. And then they they track down one PTSD trigger and literally their symptoms get cut in half overnight. Now, Crohn's disease is the term today, it depends on what website you read because it's different on every website you go on. It's inflammation anywhere from mouth to butthole. But it normally gets diagnosed when they confirm that there's inflammation in the last part of the small intestine, in the ileum. Now, the guy who discovered this his name was Dr. Burrell Crohn's. He practiced in like the 1930s, 40s, and 50s. He did not want to call it this because it's really dumb. Because if I tell you Crohn's disease, you don't know where the inflammation is. You don't know. I have to have an hour, like a 15-minute conversation just so you know what I'm talking about. He wanted it to mean regional ileitis, meaning that there was inflammation in the small intestine. When I use the term Crohn's disease, I use it just to refer to inflammation in the small intestine. I really wish we didn't have this term, but it's the same conflict. What was something important to my survival I could not absorb? You'll hear some people describe it as indigestible anger, but in reality, it's already been digested. You just can't absorb it. And they're usually angry, frustrated, and annoyed by it. So it's very hard to see this part of the small intestine. So they can diagnose this with a capsule endoscopy, an MRI, or some sort of an X-ray to see this tissue right here. And so, but if you have a lot of diarrhea and you've been diagnosed with Crohn's, look at your stool. Is your diarrhea green and has lots of bile? It burns when it comes out. This is actually more of a gallbladder issue, and we need to get that conflict under control. The majority of my symptoms were coming from my gallbladder. You know, somebody who just has their small intestine going in and out of overdrive, they're just going to get normal diarrhea that doesn't have a lot of bile in it. Now, the next condition is colitis. And this word just simply means the colon is inflamed. Itis just means inflammation. There's a term called pancolitis, which means the whole colon is inflamed. There's ulcerative colitis, meaning when they look at this with a colonoscopy, they can see ulcers. And there's another term called diverticulitis, where there's like little pockets coming out the side. And it's literally the same thing as colitis. It's just that the person experienced the conflict more intensely and for a long period of time. The conflict for colitis can be two different things depending on the types of growths that we find in the colon. There can be flat growths, or there can be cauliflower growths. And now these cauliflower growths, they aid with digestion. They secrete extra digestive juices. So if you get a colonoscopy and they see polyps, the conflict is, what was crap I couldn't break down and get rid of? The size of the polyp depends on the intensity and the length of the conflict. Now, it will be a flat growth if it's what was something important to my survival I couldn't absorb. If mainly polyps are involved, usually somebody will have a poop with like streaks of blood in it. But if somebody has flat growths, you know, you look at their colonoscopy and it's just inflamed everywhere, and usually they're having like pure liquid blood when it comes out. But this can happen and, you know, no blood comes out. I've seen that a lot. Or sometimes you just get diarrhea. There are other terms like C. diff and E. coli and Candida, which can occur in both the small and large intestine. These are the bacteria and fungi controlled by our brain, helping us remove these extra gut cells. And they will go away when the conflict is resolved, and mainly 75% of the time, the PTSD triggers are cleared out. And again, I show you how to do that in my free mini version of my 13-day protocol. It's in the bio link. So another thing that this tissue is doing, it's usually producing a lot of mucus, which just aids with the healing phase. So if somebody is pooping pure mucus, chances are there's something going on in this part of the colon, and the mucus is just ending up in the stool. If the extra mucus is being formed in the small intestine or here, it usually gets reabsorbed into the body. So if you're seeing a lot of mucus, it's usually something going on in the sigmoid or in the proctal region. Somebody will be more prone to diarrhea if their emotions are more anger, like it's like fight or flight or freeze. And diarrhea is, we need to get rid of this now. This is crap we need to get rid of. That's the biological purpose of diarrhea. Usually you want to hold on and digest your food. It's very expensive in the wild to like hunt something down, then cook it, then eat it. But if somebody is constipated or bloated, then they're trying to hold on to something important to their survival. So what's going on with bloating is somebody wants to hold on to something, so the intestinal muscles change. In the colon, what happens is, pretend this is the colon, right? These muscles clamp down and then these muscles expand to take up more room in your gut. And it's just holding on to this thing. And I've seen people go from constipation to diarrhea in a second, where they're super depressed. Oh, I really miss him. He's the love of my life. I'll never get him back. And then they get a text message from their best friend. Hey, your ex-boyfriend tried to hook up with me last night. Oh, he is a dirty pig. I want nothing to do with him. Diarrhea. Just in a second. Every muscle in your body is working just fine, except for your intestinal muscles. What's going on there? So what Dr. Hammer discovered is that every condition is controlled from a very specific location. Now, here starts the stomach. And now that won't be heartburn, but that'll be stomach cancer. Then there's the duodenum. Then there's the duodenum. There's the ileum. There's the first part of the colon, the transverse, and then the sigmoid. It's all in a nice, neat order. Seeing these brain CT scans are what convinced me that this stuff is real. And I got my brain CT scan done, and I had inflammation in my small and large intestine, and my brain CT scan clearly showed that, and I show you that in my free webinar on my BioLink. Somebody will have black poop. A lot of the time this can come from just eating like a lot of Oreos, or having a Guinness beer, having beet juice, or taking activated charcoal. But if somebody's bleeding high up in the digestive system, then their stools could look black. Now, your stools will turn dry if the kidney collecting tubules are active. And this person will also sometimes have moon face. They'll gain a lot of water weight unexpectedly. And on their brain CT scan up here, there will be rings formed. This is an existence conflict, a refugee or an abandonment conflict. A lot of people get this after they get diagnosed with Crohn's or colitis, and their doctor, gives, oh, we don't know the cure. Oh, I'm too lazy to look for the cure, and you're going to have to be on my expensive drugs for the rest of your life. Oh, we're going to have to cut this or that out. When someone hears that and they believe it, that type of trauma is like, when something traumatic happens to you, it's like getting struck by lightning, and you go like brain dead. I had one guy who was separated from his girlfriend. They lived in separate countries, and then COVID happened, and so he was separated from his girlfriend. And so for like 2 years, they couldn't see each other, and he gained a ton of weight, and he was always a skinny guy. But then when the bans were lifted and they got back together, his weight just went away. So we also have hemorrhoids and fissures. So for women, this is going to be an identity conflict, and for men, it will be a territorial anger or an identity conflict. And during the conflict active phase, it's cell loss. So you get the anal fissures that develop, and they burn. Then when the conflict gets resolved, it's cell restoration. And when it's on, off, on, off, on, off for a long time, that's when the hemorrhoids start to form. So there are things we can do to not irritate those things, like so you could use like a bidet, and after you go to the bathroom, rub some coconut oil on it or something, so you're not just like rubbing sandpaper on it all day long while you're going to the bathroom. Like, that can help, but the conflict needs to get figured out. The PTSD triggers need to get figured out first, or as soon as possible. There's also perianal fistulas and abscesses. I had a horrible perianal fistula. If you resolve the conflict and keep it resolved within the first 6 months, it can go away by itself. But usually what happens is scar tissue forms along the track, and it's like there permanently. And so you can either get that lasered shut, or you can do, which I did and it came back, or you can do the Ayurvedic treatment, Ayurvedic thread treatment, where I have a whole video on how to explain that. But I did that. It took a month and a half, and my fistula hasn't come back. And it's been about 3 years since I did that. So a perianal abscess and a perianal fistula are just two sides of the same coin. That abscess forms on the perianal duct, and the conflict's off and on with cell loss, cell restoration, cell loss, cell restoration, and then that junk gets trapped and it needs to go somewhere, so the body creates a fistula, a tunnel, to drain out all the crap. And sometimes this tunnel goes into the urethra, sometimes it goes into the vagina, or goes all sorts of weird places, but normally it goes into the sigmoid colon or the proctal area, or it just gives you a second butthole. I had 2 or 3 buttholes at some point. Lots, very sexy. Looked like roadkill in my pants every day. There's also terms like leaky gut and histamine intolerance, where there's little holes in our gut and the toxins leach out into our system, and I'll get rashes or I'll get acne. Now, this theory doesn't make any sense, because everybody with acne in this part of the brain right here, they will have rings. So you're telling me if I have leaky gut, I eat something, the toxins go all throughout my body and they only make a rash here? That makes literally no sense whatsoever. And histamine intolerance is the same way. There's this one girl online, she has this horrible face rash, and she's like, I have histamine intolerance, I have leaky gut. So you're telling me every time you eat something that's not on your clean list, which you've been doing for 2 or 3 years by now, and your face still looks horrible, what you're telling me is that every time you eat, these toxins go all throughout your body and they only create symptoms here. That is bullshit. And the funny thing is, these symptoms all probably started after a big breakup. So histamine intolerance and leaky gut are bad, incorrect terms we should not be using. Instead, we need to go on learninggnm.com and try to figure out what organ is going in and out of overdrive and producing these symptoms. In my webinar, I go over some more conditions like acne. I had horrible acne. I go over psoriasis and eczema, anemia, arthritis. I go over more autoimmune diseases, and I go into more detail on what I just did here. So this is a new idea for a lot of you. The majority of the treatment is just finding the traumatic event and finding the PTSD triggers in the relation to the traumatic event. This is very hard for the brain to hear because it's such a new and different concept. It took the therapy, the cure, the magic pill you need to take is sitting down with a piece of paper or going on the computer and making a very detailed timeline like you're a CSI detective and trying to figure out what traumatic event put whatever organ in and out of overdrive. And it takes some time. Your brain is very lazy. It doesn't want to dig up old memories. It costs a lot of calories. It costs a lot of brain power. And it's trying to protect your conscious mind from feeling pain. But if you keep digging, it will eventually pop up. So celiac disease, again, another really dumb term, because it used to be the word we had for Crohn's disease, essentially, because celiac is Greek for abdominal. So you had diarrhea, okay, you have celiac, you have abdominal disease. That's literally what the term meant. Up until the 50s, then this guy started to slowly change the term, and then he didn't have success with the gluten intolerance diet, the gluten-free diet. I don't know why he did it. And then an Italian doctor in the 90s and the early 2000s popularized gluten intolerance and this stupid leaky gut theory. So celiac just means, or any food intolerance, a lot of food intolerances happen when somebody gets symptoms for the first time. They are like they see blood in the toilet. They're freaking out. Oh my God, there's blood in the toilet. I would freak out. They go online, they watch some holistic idiot, and they go, oh, blood's bad for you. Meanwhile, they're wearing a cross, which means in the Bible, it's referred to as the staff of life, take your daily bread and shut up. And yet they're afraid of the very thing that keeps them alive. But the brain is in such a vulnerable state, it's like, oh, okay, it's true. It must be true. Somebody with 1,000 views said it was true, it has to be true. Oh, dairy's bad? Baby food's bad? Okay. Oh yeah, I had a milkshake today. Okay, you had a milkshake a million times before this time. Why is baby food making you react now and not before? A lot of kids get force-fed milk when they're kids when they don't want it. A lot of kids first morsel, their first important thing to survival is milk, but mom's busy or mom's not home. Oh my God, I'm going to starve to death. Babies can experience trauma as well because they're freaking helpless. But I watched a video the other day where this guy was eating a sandwich on a train, and you're not allowed to eat on trains, and so this officer like arrested him when he wouldn't like throw the sandwich away. So maybe now every time this guy eats a sandwich, he has diarrhea, and then he thinks he's gluten intolerant, but he's like, wait a second, when I have pasta, I don't have symptoms. I wonder why. It's when I have gluten in the form of sandwiches, I get diarrhea, because it's a subconscious reminder of the conflict. Even if he's not even thinking about that incident when he's having a sandwich, it's this weird thing. You see it in movies all the time. So I help people, you are one aha moment away. These aha moments, that's when we know we flipped the switch in the brain. You know, I can't sit there and yell at you for 3 hours straight. The next best thing for you to do is to do my free webinar, and it's like a mini version of my 13-day protocol in a much nicer fashion with a lot more better visuals and much organized and much structured. I'm poking this part and that part of the brain to flip these switches so it stops, so you can have the realization that you need so your brain stops putting your gut in and out of overdrive and making your poop look like that.